Hey, how's it going? My name's Kaden and I am from Melbourne, Australia. I identify as non-binary transmasculine, and this is going to be a update video of me being on testosterone for 9 months now. Last month I didn't do an update as I didn't really have any things to update on. I still haven't had all that much, but figured I should jump on and say hi. Where to start? I think my voice has changed a little bit. It is still jumping up and down. It's not exactly staying level or anything. I feel like it's gonna be like that for quite some time. But I'm pretty sure it's gotten a little bit deeper since my last video at 7 months. I haven't noticed it, but my girlfriend said that she can start to see a tiny little lump starting to happen of an Adam's apple. Whether that's a thing or not, I do not know, but if it is, then that would be cool because I never even thought of that. Yeah. Hair growth. The hair on my legs is really hard to judge in terms of how much hair growth I've had, because I only stopped shaving my legs about a month, I think maybe 2, before I started testosterone, so it's kind of difficult to judge what was just growing at normal pace and what the full length of my hair was if I'd stopped shaving, because I've never really stopped shaving before. So trying to tell what would have been my before normal hair growth rate and the difference between it now of me being on testosterone, I'm not exactly sure. But my legs are super hairy, are probably more than average for a cis man, which is kind of cool. I feel like a lot of people don't have much hair on the upper part of their legs, where I don't seem to have that problem. Weirdly enough, I have more hair on the inside of my thighs than the outside for some weird reason. Not too sure. But obviously my hair is quite dark, and my skin is very pale, so the hair on my legs is showing quite a fair bit. But it's cold in Melbourne now anyways, so I'm wearing pants. So yeah, but yeah, when it was a bit warmer and I was wearing shorts, yeah, I found myself kind of walking around comparing my leg hair amount to other guys, which was a little weird, but it is what it is. I am weird. So other hair growth, my stomach started growing hair a couple of months ago. I feel like I've gotten quite a bit more. This is not something I am overly keen on. I don't like it at all, but I don't want to shave it or anything because I think it's just gonna go like really coarse and kind of like spiky, because at the moment it's like still just like soft hair. Yeah, I really don't like it because it's not just a snail trail, it's like my whole stomach, which you know, a lot of people really like that, but I do not. But that's okay. It is what it is. It's part of the package. On my face, I've had nothing. I feel like I haven't had all that many changes in the last 2 months, but all of a sudden in the last 2 weeks, I've started to get a bit more hair growth on my mustache, and just on my chin here, mainly towards like the side bits here, which is really weird because um, I can feel them, and I keep thinking that I've got something on my face, so I'm constantly like wiping my face, thinking I've got food crumbs or like a piece of, fluff or something on my face. It's just not used to the feeling of being able to feel the hair, which is really strange. Um, yeah, before I started tea, I was really not keen on the facial hair. It was the one thing that was made me um, sitting on the fence and thinking about, do I or don't I, because of starting testosterone, because yeah, the facial hair was a big turn off for me, and I didn't want it. But now that it's starting to grow in, I don't know, I'm kind of liking it a little bit. I'm not too sure about the ones on my chin. I don't think I really like that, but yeah, it's really weird because there's not many, but they're super long. I'm talking like about an inch long on my chin, which is strange, but anyways. Yeah, but the mustache, I don't know, I think I'm gonna leave that. I don't want to shave because, again, it's gonna come back like stubbly and like thicker and more coarse, so I'm not really wanting that kind of prickly feeling on my face. But obviously if I don't want the hair, I'm gonna have to shave it. So I don't know, at the moment I'm just kind of leaving it and seeing what happens. I'm also just kind of curious to see like how much it will grow, so I'm just kind of leaving it for the moment. But yeah, with everything else, like the hair on my arms and stuff is still the same. Yeah, I don't know. I can't really notice many other changes other than a bit more facial hair growth and a little bit of change in my voice. I was getting a bit down about it this past month because the last time I had my blood tests, my levels had dropped as meant to be. Well, my doctor says it's meant to be between 10 and 15, and it was previously in the middle at like 12.4, but the last time I got tests it was down to 8, which kind of explained why I got to 5 months and then nothing was happening. Like I felt like I wasn't even taking the testosterone at all, like nothing was happening at all. And so yeah, my doctor gave me the option to up my dose. I'm taking the Androfork cream. I was on 1 milliliter a day, and I increased to 1.5. So I've been doing that for 2 months now, and still not really had any changes. It's literally just been in the last 2 weeks I've like had a couple of more hairs grow on my face, but other than that, it's still been like mega slow. And I'm getting a bit frustrated at this point. I wanted slow, but it's a bit too slow for me now. And I had a lot of blood tests last week, so I've got another appointment to check in on that tomorrow, to see how things are going since I've upped my dose. But honestly, I'm thinking I'm going to see if I can take a bit more again. And I've also been considering the Reandron shot, which is the one that you take every 3 months, rather than the weekly or fortnightly one. The reason I don't want to do that is because I don't think I can inject myself. I'm fine with needles. I don't think I can bring myself to give myself an injection. So I'm thinking that the 3 monthly shot might be the better option, in terms of the doctor's going to be able to do that for me, because the needle is bigger and the liquid itself is a lot thicker and oily, so people have said, so therefore it needs to be injected a lot slower, so that's why the doctor does it and you can't do it yourself. So I'm thinking maybe my body might react a little bit differently to that, and maybe I will get a few more changes at a slightly faster pace than the cream. I don't know. I'm gonna ask about it tomorrow. That's pretty much all I know about it, so I'm gonna see what she says and get a bit more info on it, and I can take it from there to decide if that's what I would like to do. Yeah, I think that's about it. So I'll leave it at that, but I did have a consultation with a surgeon about top surgery, which was really exciting. But I'm going to do a separate video about that. So if you are interested in that, then hold tight. I will put that up shortly as well. But other than that, thank you so much for watching. I appreciate all the people that have been watching from the start, or been watching my videos. If you are new to my video, then welcome. Thank you for watching. I hope this was of some use, and yeah, I'm going to keep making the updates, and I will pop up the top surgery consult as well. But then yeah, have a wonderful day, and I will see you then. Bye.